The vision of NDM is a state where humans can live their lives free of premature death and life-changing illness, regardless of where they live in the world.
The Nuffield Department of Medicine is the largest research department in any university in the United Kingdom, well known for its contributions to many healthcare challenges, from COVID to genetic disease, over the last 50 years.
His 2019 Nobel Prize, Professor Sir Peter Ratcliffe, Nuffield Department of Medicine.
Our next guest quite literally helped to save the world.
We've been supported by an absolutely fantastic team in Oxford.
The UK has 100 million doses of the Oxford AstraZeneca vaccine on order.
No other Department of Medicine in the world has our global reach or involves so many people from overseas in its research. The overseas units have had a major impact on WHO guidelines, more, I'm sure, than any other department worldwide.
Trying to get to the heart of how do we improve the outcomes for patients. The answer to that isn't going to come from one single research group. It's going to involve all of those research groups getting around the table and working out how they can generate the data and integrate it to give a meaningful clinical answer.
There's a real sense that it's the problems that define us, not the departmental labels.
NDM being a very large department gives you opportunity to bump into people, discover people's expertise. It is with that ecosystem, that culture, that environment enabled us to identify the right collaborators.
What was unique for me about the collaboration here, first of all, we had a joint vision of what we wanted to achieve and how we wanted to achieve it. That is the principle by which we're going to make sure that the capital we put into this goes as far as it possibly can to help patients.
We have a number of technology platforms. They're rapidly evolving, and so it's a challenge to keep up with those, and so we centralise those as much as possible and share them amongst the units.
Oxford is an extraordinary place to recruit students. We have people coming from all corners of the world with amazing CVs. They've fought really hard in a very competitive space to get a slot in the lab they want to work in for their research.
They're really the bedrock of the department. They challenge us, they enable us to think differently.
Everybody who comes here to do research, no matter what their project, I think has a dream. They understand there's some big goal, whether it's eradicating a disease like in malaria or slowing down or preventing another completely different disease like Alzheimer's disease. Everybody who turns up when they're in their early 20s is probably going to live to see most of those impacts happen, and hopefully they'll do it here.